Hello, I'm Farah Nasralli. I'm a longtime dedicated yoga student, longtime teacher, and I'm particularly interested in having conversations around how yogic tools and practices can be applied during times of intense stress. And over the last 2 years, we've definitely been in a time of intense stress. And I'm really excited to be in conversation with a dear friend, Corrine Mckell. Do you want to say a few words about yourself?
Sure. Thanks very much, Farah, for having me. My name is Corrine Mckell, and I am, as well, a longtime yoga student, a yoga instructor. I also work as a frontline nurse and as a nurse educator. And I'm really interested to talk with Farah about how the skills of my yoga practice has really helped support me as a nurse, and my passion to share these skills with my community and in the healthcare professionals I work with.
You know, I know that mindfulness and meditation practices are not a substitute for structural changes that need to happen in the health industry, in nursing and healthcare. And I suspect that underneath those structural changes that need to take place is also a culture that needs to change.
Yeah.
What can you say about the culture in terms of how mental health and mental well-being, has it become more a part of conversations since the pandemic?
Yeah, absolutely. Absolutely. In my workplace, it certainly has. I really felt like being a nurse was we had just this expectation that we could be exposed to some really, really hard moments in people's lives and share these experiences that are, really intense and really sad, and oftentimes associated with trauma, physical trauma, emotional trauma. And we never talked about how we were doing, like how we felt about these situations, and about our days. There was a couple, unique scenarios where we would do that naturally as a team. So in particular, you know, um, when there was a really challenging time with children, babies, like those, for sure, we were really great at coming together and debriefing. But other than that, there wasn't a conversation about how we were feeling mentally and how we were going home at the end of the day and the effect that it was having. And then it's one of the silver linings of this pandemic is finally it was just at that point where, I mean, what could we expect anymore, right? And it was like finally we're talking about the toll it was taking on healthcare professionals mentally, emotionally, on our families. And then it led to other than the pandemic as well, right? Being a care provider has its challenges, and that we do need to change the culture to be more supportive and talk about how we're taking care of ourselves and each other. And it's so important to do with amongst ourselves is because, and to establish some kind of like making it normal to talk about it regularly, how we're doing, not just in the extreme circumstances, right? So it becomes more natural. And to do it amongst each other is so strong because we can relate, right, to the experiences that we share as healthcare providers on a different level than we can with our friends and our partners. So
Yeah, I think about the way that mental health has really become so much more normalized in the regular culture, and how it's so great to see that people can openly talk about seeing a counselor or seeing a therapist, and it's become acceptable to do that. And how important when you're in a caregiving role it is to really attend to your mental health and emotional health.
absolutely. And it is now like everybody, like I'm often speaking to everybody I know in my life about going to counseling. Like, do you have a counselor? Do you have a therapist? Right. And so that you're right, that is changing, and that's going to be a benefit to all of us. Okay, what was it I wanted to...
And also how, those kinds of interventions, seeing a counselor, a therapist, really just the simple fact of being validated in your grief or in your sadness or in whatever emotional state arises, knowing that it's not abnormal, that it's actually normal to experience anxiety if you've been exposed to trauma, or it's normal to have certain emotional experiences if you've undergone or witnessed intense things in your job.
Yeah, and you know what, Farah, to be honest, I wouldn't say we're really recognizing that still as the healthcare
So
professions.
there's still a long ways to go.
Yeah, yes. Like when I speak to my colleagues about that, right, that when we're bearing witness to a person's trauma on a daily basis, that it's going to affect us emotionally. And when I bring that up to a lot of people, as I was at first when I learned that, it was kind of like, you think? A bit? Really? And of course, yeah, of course it affects us with sleep, right? With moods, with memories. And back to what we were saying about the therapy and having counselors, that has been, again, it's been now accepted because of the pandemic to openly talk about it and to seek help and support.